Hello everyone. Today I will be presenting on the changes to the Affordable Care Act, also known as ACA, since 2016 and the impacts on cost, access, and quality. My name is Elizabeth Akingbade, and I will be presenting on behalf of my team, which includes Taylor Barron, Paola de la Cruz, Casey Howard, Collins Nubiga, Alyssa Vasquez, and Lauren Simpson. The purpose of this presentation is to explain how changes to the Affordable Care Act since 2016 have influenced healthcare coverage, affordability, and quality in the United States. Purpose and overview. The Affordable Care Act, or ACA, was enacted in 2010 as a comprehensive healthcare reform law designed to expand insurance coverage, improve quality of care, and reduce healthcare costs, particularly for low-income populations. Key provisions of the Affordable Care Act include Medicaid expansion in participating states, the creation of health insurance marketplaces, required coverage of essential health benefits, protection for individuals with pre-existing conditions, and allowing young adults to remain on their parents' insurance until the age of 26. The ACA also introduced value-based payment models and accountable care organizations to improve efficiency and healthcare quality. As a result of these reforms, the uninsured rates declined significantly, reshaping the United States healthcare system. Policy changes since 2016 matter because they directly affect insurance coverage levels, reimbursements, and patient access to care, which in turn impacts how healthcare organizations operate and plan financially. Major Affordable Care Act policy changes since 2016. Since 2016, several policy changes have altered how the ACA operates. These include the elimination of the individual mandate penalty, changes to premium tax credits, expanded use of short-term insurance plans, Medicaid redeterminations following the COVID-19 public health emergency, and increased use of state-level waiver initiatives. Because healthcare reimbursement is closely tied to insurance coverage, these changes directly affect hospital revenue and financial stability. Coverage expansion generally lowers uncompensated care, while coverage losses increase financial strain, especially for rural and safety net providers. Coverage instability also affects continuity of care and performance under value-based payment models. What happened to newly covered populations? One of the most important outcomes of the Affordable Care Act was a reduction in the uninsured rate through Medicaid expansion and subsidized marketplace coverage. Newly reinsured individuals experience improved access to preventative services, primary care, and prescription medication, leading to better health outcomes. However, coverage gains were much larger in Medicaid expansion states compared to non-expansion states, creating geographic disparities in access to care. Now, although expanded coverage reduced uncompensated care costs, many low-income adults in non-expansion states remained uninsured. What are health insurance exchanges? Health insurance exchanges, also known as the ACA marketplaces, allow individuals to compare and purchase health insurance plans. Eligibility is limited to United States citizens and lawfully presented individuals. Federal exchanges are operated by the federal government for states without their own marketplace. And state-based exchanges are operated or governed by individual states and allow greater flexibility in outreach, plan management, and consumer assistance, which can improve enrollment and affordability. How states are approaching exchanges. States use different strategies to manage insurance exchanges, including state based marketplaces, federally facilitated marketplaces, targeted state subsidies, reinsurance programs through Section 1332 waivers, and complementary policies. State-based exchanges offer better coordination with Medicaid expansion, while federally facilitated marketplaces typically have lower administrative costs but less flexibility. Now, reinsurance programs and state subsidies help stabilize insurance markets, reduce premiums, and encourage insurers' participation. Medicaid's role in the Affordable Care Act. Medicaid plays a central role in the Affordable Care Act. The ACA expanded Medicaid eligibility to adults earning up to 138% of the federal poverty level, targeting low-income individuals without employer-sponsored coverage. Now, most states have adopted Medicaid expansion, while non expansion states maintain stricter eligibility rules, creating geographic differences in coverage. Medicaid expansion has increased insurance coverage, improved access to preventative and primary care, and reduced uncompensated care costs for hospitals, particularly those serving vulnerable populations. Impact on insurance premiums. Health insurance premiums reflect overall healthcare spending growth and market conditions. Premium trends vary by state due to differences in insurer participation, population risk, and local healthcare costs. Now, federal premium tax credits significantly reduce out-of-pocket premium costs for eligible enrollees and improved affordability. Now, in 2023, approximately 4 out of 5 marketplace enrollees received premium tax credits, substantially lowering their monthly insurance costs. Political and market variables affecting outcomes. Now, political and market variables strongly influence the Affordable Care Act outcomes. Political polarization, state-level decisions, and policy changes affect affordability, enrollment, and insurer participation. And market factors such as premium costs, subsidies, and enrollment levels also affect the stability of the Affordable Care Act marketplaces. Key policy changes today. Now, despite its successes, the Affordable Care Act continues to face significant challenges. Coverage gaps persist in states that have not expanded Medicaid, creating unequal access across regions. Now, affordability remains a concern for individuals who do not qualify for subsidies, while rising healthcare costs place pressure on insurance markets and public spending. Provider shortages and workforce distribution issues further limit access to care, and ensuring long-term funding sustainability remains a major policy priority. Overall impact on cost, access, and quality. Overall, the Affordable Care Act has had mixed effects on cost, access, and quality. Access improves sustainability with over 20 million Americans gaining coverage and uninsured rates declining nationwide. Quality improved through expanded preventative services, value-based payment models, and reduced hospital readmissions, although long-term system-wide improvements remained mixed. And at the same time, overall healthcare spending continues to rise nationally. Now for the final evaluation. Has the Affordable Care Act, also known as ACA, been effective? Based on current evidence, our team concludes that the Affordable Care Act has been effective in expanding insurance coverage and strengthening access to care. The Affordable Care Act also improved financial stability for healthcare organizations in Medicaid expansion states and produced moderate quality improvements through value-based reforms and preventative service expansions. However, the ACA has had limited success in controlling overall healthcare costs and reducing geographic disparities. Overall, we conclude that the Affordable Care Act has made meaningful progress, but is not a comprehensive solution to healthcare affordability. We have come to the end of our presentation, and we thank you for tuning in with us. In these final slides are the list of academic references and policy sources used to support this analysis, including data from the CDC, the CMS, the Congressional Research Service, the Kaiser Family Foundation, and peer-reviewed research.